The buildup of plaque inside arteries, known medically as atherosclerosis, has long been considered a one-way street. Once it begins, the common belief was that you could only slow it down but not reverse it. Yet over the last decade, a growing body of research has shown that while calcified or hardened plaque is extremely difficult to reduce, the softer, fatty plaque that clings to arterial walls can in fact be shrunk, stabilized, and made less dangerous through a combination of medications and lifestyle interventions, which is both hopeful and empowering news for millions of people worldwide worried about their heart health. To understand how, let's first look at what plaque really is. Arteries are meant to be flexible, smooth, and elastic tubes that carry oxygen-rich blood from the heart to every organ. But with time, factors like high cholesterol, high blood pressure, smoking, diabetes, obesity, and chronic inflammation damage the delicate inner lining of these vessels, called the endothelium, allowing LDL or bad cholesterol particles to slip inside, get oxidized, and trigger immune responses that lead to fatty streaks, foam cells, and eventually the formation of plaque. Some plaque stays soft and fatty, while other portions calcify and harden like cement, narrowing arteries and sometimes rupturing, which can suddenly block blood flow and trigger a heart attack or stroke, which is why stabilizing plaque is often more important than removing it entirely. Now, the million-dollar question people ask is, can you reverse plaque? Can clogged arteries really become less clogged? The answer is yes, at least partly, because numerous studies, including the famous lifestyle heart trial by Dr. Dean Ornish, have shown regression of soft plaque with intensive lifestyle changes like a whole food plant-based diet, regular exercise, stress management, and smoking cessation. While modern cardiology also uses statins, PCSK9 inhibitors, and certain anti-inflammatory medications to stabilize and in some cases shrink plaque, though lifestyle remains the cornerstone because no drug can undo the daily damage caused by poor habits. Among the most powerful dietary interventions is adopting foods that naturally lower LDL cholesterol and boost HDL cholesterol, such as omega-3 rich fatty fish, flax seeds, walnuts, and chia seeds, along with high-fiber foods like oats, barley, lentils, beans, and plenty of fruits and vegetables, especially leafy greens and cruciferous vegetables, because fiber binds cholesterol in the gut and prevents it from being reabsorbed, while plant sterols and antioxidants help calm inflammation inside the arteries. Equally important is reducing the intake of processed and fried foods, trans fats, excess red meat, and added sugars, since these are strongly linked to plaque buildup. Even small, consistent shifts, like replacing sugary sodas with water or green tea, or choosing grilled foods over fried snacks, can tilt the balance in favor of cleaner arteries. Exercise is another pillar. Brisk walking, cycling, swimming, or even dancing for at least 150 minutes a week not only improves circulation but also enhances the production of nitric oxide, a chemical that relaxes and widens blood vessels, making them less prone to plaque deposits. In fact, studies show that regular aerobic activity can increase HDL, reduce triglycerides, and promote regression of soft plaque over time, while resistance training adds additional benefits by improving insulin sensitivity and muscle mass, both of which protect against metabolic syndrome, a major driver of atherosclerosis. Stress management is often overlooked but deeply significant, because chronic stress keeps cortisol and adrenaline levels high, which raises blood pressure, fuels inflammation, and promotes plaque instability, whereas relaxation techniques such as yoga, meditation, tai chi, deep breathing, or even mindful hobbies like gardening can lower stress hormones and support vascular health. Sleep is another underestimated factor. Getting 7 to 9 hours of restorative sleep regulates metabolism, reduces cravings for junk food, allows the cardiovascular system to repair, and lowers blood pressure, all of which contribute to healthier arteries. while poor or fragmented sleep increases plaque buildup by disturbing hormonal balance and raising inflammatory markers. Beyond lifestyle, medical therapies play a supportive role. Statins are well known for lowering LDL cholesterol and stabilizing plaque. PCSK9 inhibitors provide dramatic LDL reduction in high-risk patients, and certain anti-inflammatory drugs like colchicine are now being studied for their ability to reduce cardiovascular events by calming inflammation within plaques. But it is crucial to remember that these work best alongside, not instead of, diet and lifestyle changes. Another key aspect of reversing plaque is improving endothelial health, which can be supported by foods like beets, pomegranates, dark chocolate, and green leafy vegetables rich in nitrates, because they boost nitric oxide production and improve vascular elasticity. Even moderate coffee and tea consumption have been linked with arterial health, provided sugar and cream are not overdone. Smoking cessation is absolutely non-negotiable, as smoking directly injures the endothelium, lowers HDL, raises blood pressure, and accelerates plaque buildup. Quitting smoking almost immediately improves circulation and within a year dramatically reduces the risk of heart disease. Alcohol should be consumed sparingly if at all, because while small amounts of red wine have been touted as heart-healthy due to polyphenols, the risks of alcohol often outweigh benefits, particularly with regard to blood pressure and arrhythmias. Hydration plays a role too. Adequate water intake keeps blood less viscous and reduces the risk of clot formation, which is especially important in arteries already narrowed by plaque. For those with diabetes or prediabetes, tight blood sugar control is essential, because excess glucose damages blood vessels and accelerates plaque growth. So monitoring carbohydrate intake, choosing low glycemic index foods, and adhering to prescribed medications becomes part of plaque reversal strategy. Another practical yet underappreciated tool is regular health screening. Knowing your blood pressure, cholesterol profile, blood sugar, and weight trends allows early action. Because plaque does not develop overnight but over years, silently, without symptoms, until it suddenly causes a crisis. Advanced imaging tests like coronary calcium scoring or CT angiography can also identify early plaque and help tailor prevention strategies. But most people don't need them unless high risk is suspected. The good news is that plaque reversal is not about perfection but persistence. Every positive lifestyle choice, whether it's a healthy breakfast, a 30-minute walk, or a night of good sleep, contributes to the long-term cleaning and strengthening of your arteries, while every skipped unhealthy choice, like avoiding that extra fried snack or saying no to another cigarette, prevents further damage. And perhaps the most empowering message is that age is not a barrier. Studies have shown regression in patients ranging from their 30s to their 70s, proving that it is never too late to start. So, to answer the question clearly, yes, soft arterial plaque can be reversed or at least stabilized, and the roadmap is surprisingly straightforward. Nourish your body with real, wholesome foods, move it daily, calm your mind, rest it adequately, avoid toxins, monitor your health, and seek medical guidance when needed. By committing to these science-backed strategies, you can reclaim arterial health, reduce the risk of heart attacks and strokes, and give yourself not only more years of life but more life in your years. Because a heart free of unstable plaque is not just a medical achievement. It is the foundation of vitality, energy, and peace of mind that allows you to live fully and fearlessly.